One thing about chronic pain patients is how much we have in common. And I'm really seeing this here in this PJ Media article. This is from David Manney again. And he's focusing on veterans, but of course veterans aren't the only ones with chronic pain. But you do get to see how the VA just leaves pain patients behind, and it's terrible and horrible. As it is with so many of us, so let's get into this. He says, talk to someone living with chronic pain and they'll tell you the truth about chores. Oh my God, yes. Now he starts using the word us. I don't think he said, or if he has, I missed that article. But is Manney a pain patient? That might explain why there's all these articles all of a sudden, because trust me, that will get you a front row seat, if not a starring role in everything that's happening. Most of us can clean the kitchen once. We can mow the lawn, some of us can't. Fold laundry or unload groceries once. But the next day, that's when walking feels like punishment. Lifting your arms is a gamble. Standing upright becomes a math problem your joints refuse to solve. I know exactly what he means. Actually, more like an engineering problem. It's like, okay, how do I make this happen without using this part of my body? Even brushing your teeth can trigger a wave of pain so sharp you need to sit down. Pain doesn't always scream. Sometimes it simmers. And that quiet, constant ache is what breaks people. Not just their bodies, but their dignity as well. This is how it goes, because I can have a pain in my shoulder, my hip, my knee, and that pain would be like an 8 or 9, but just there. And it's like, well, I can kind of hobble around and do things. If the pain is lower than that, it's a 5 or 6, but it's kind of that dull, all over pain. It's just like, ugh. And I'm just sunk down into this chair here and I can barely move. And it's like, I just want to do things that normal people can do, like sit up straight. The system built to help them, including insurance companies, the VA, and federal watchdogs, continues to fail. Not because they can't help, but because somewhere along the way, someone decided pain patients were easier to ignore than to understand. And he also mentions that they removed the paywall for this series, so thank you so much for that, PJ Media. So these are going to be from anonymous veterans. The first one says, I was severely injured in a near-fatal motor vehicle accident through no fault of my own in my early 50s. Exactly like me, except I was in my late 30s. The driver who hit me wasn't insured, neither was mine, and barely spoke English. Mine didn't speak anything because he was dead. I was only 10 credits short of my degree. My kids were already grown and independent with their own degrees. I'd waited to pursue mine. The surgeon had a long list of procedures I needed, but I couldn't afford them. So I was handed off to pain management, where they poked and prodded me with torturous procedures, charging me $600 for urinalysis tests that should have cost $94. I tried everything they suggested. I ran out of money before they ran out of ideas. I finally went back to my family doctor. I told him I was tired of the Lortab fog. He treated me for years and knew my history. Together, we created a treatment plan that worked. Medications with minimal side effects that also helped my high blood pressure and mental health. Things weren't perfect, but they were livable. Then he qualified for VA healthcare. My doctor there picked up my plan and did everything he could to help. For over 7 years, I managed. I even picked up some part-time work from companies I'd worked with in the past. Then he retired, and everything fell apart. Oh man, I feel ya. Losing the guy who set you up with all this? Suddenly, I was told I had to choose between pain care and mental health care. They would no longer treat both. I asked about my blood pressure meds, but those, of course, were allowed. The irony wasn't lost on me. It's not lost on me either. I know exactly what you're talking about. 'Cause blood pressure goes up with pain levels. If you're a pain patient and your pain is ill-treated, you've got high blood pressure. Get proper amounts of pain medicine, the blood pressure goes down. But they don't want to do it, so you have to go on blood pressure medicine. They tried pushing me to take a medication intended for opioid use disorder. Let me guess, Suboxone, right? One more case of the Suboxone grift. It was contraindicated, and I told them that. Didn't matter. They refused to treat me any further. How often have we heard that story? They try to push Suboxone on you, which doesn't do anything for pain, and has all these terrible, torturous side effects, including like ruining all your teeth, may even cause mouth cancer, all sorts of horrible side effects. Suboxone is horrible. But if you turn it down, they treat you like a drug addict. I finally completed a VA review and was recognized as a disabled veteran. That was supposed to unlock guaranteed VA healthcare. I was even paid, but care still denied. Yeah, being paid doesn't do a whole lot when the pain care isn't available at any price. I reached out to everyone, VA facilities, congressional reps. I was told over and over, it's VA policy, we can't help, always passing the buck over. That's how so many veterans get left behind. And then finding out how many other veterans, some worse off than me, are dumped and discarded like last week's trash. Yeah, and not just veterans. It's heartbreaking being on the pain forums, seeing all of the other people who are in so much worse pain than I am being denied their medicine, and some of them even saying that that's going to be their last post because the pain is so bad that they have decided that they no longer want to be with us on this world. And that's a horrible tragedy. Why isn't anyone doing anything about that? That's horrible. There is zero accountability in the VA system, even when someone dies. All the OIG does is make recommendations. They don't care, and we know it. Yep. And then we have a 64-year-old former paratrooper doing okay until they took away oxytocin. After that, my life collapsed into these four walls. Now I sit in this house every day, depending on my wife for everything. Shout out to my wife and all of the wives and husbands and other loved ones of all pain patients everywhere. You have no idea how much you help us. I know my wife feels helpless. She's not. She helps me a lot more than she knows, and I try to explain it to her. But it's hard to make someone understand when they're not in that position. They treated me like I was chasing a high, like I was a dopehead, not a veteran, not a husband, not a man trying to manage his pain. I just want to live in a world where we're treated with respect again. And everyone please understand, when I had my accident, my kids were 5 and 8. So going through that and being on all that pain medicine and being on hydrocodone the whole time, I raised my kids. I made sure they got to school. I made sure they excelled as well as they could. As most of you know, my son has autism. He had to go to special school. He needed all these special things that I had to deal with and work and to help nurture him and help him grow and learn through all of that so that he can become the adult he is now. My daughter, I saw her through school. I saw her through hard times. She went through some things in school that no one should have to go through, such as just losing her best friend, who went to bed one night and didn't wake up the next morning when she was 12. And that was terrible. And I helped her through that and got her all that. And now she's grown and married with a good career. I did all of that on opioids. I couldn't have done it without it. Those drugs do not make us these layabout addicts not doing anything. They enable us to live lives. That's what they do. All right, another anonymous one. Allergic to every NSAID, including aspirin. Allergic to synthetic opioids, including tramadol and fentanyl. Used to take Fioricet with pseudoephedrine, but now they cap it at 8 pills a month due to the barbiturate. It was the only thing that worked. Just taken from him for no reason. For no good reason whatsoever. And then hydrocodone. He was on 10-325. Then one day, with no notice, cut in half down to 5. The prescription said daily, but I took them as needed, usually less. Oh yeah, everyone knows about breaking the pills in half, I'll tell you that. Which, by the way, is the opposite of addict behavior. And yet they'd probably consider that another symptom of opioid use disorder. I probably shouldn't give them ideas. After moving to Tennessee, it took a year to reestablish my care. For hydrocodone, I had to go to a pain specialist 45 minutes away during COVID and then wait for the meds to be mailed. Now it was a 90-minute round trip plus a doctor's appointment every month for a 30-day supply. Acetaminophen will destroy your liver. We've covered that. The safe max is 4 grams a day. That's 8 500 milligram tablets. The Vicodin from TV shows, and he's talking about House MD, if you remember that show. Back then, each Vicodin pill had 500 milligrams of Tylenol instead of 325. Paracetamol, whatever it's called where you are. But the fictional Dr. House would have been dead in real life. Dead, dead, dead. Not from the opioid, but from the acetaminophen. His liver would have failed, and that would have been it. I'm not addicted, never have been. Opioids work for me, and I don't abuse them. But because someone somewhere might, I get treated like a risk. I know exactly how you feel. We all know how you feel. It's not the chronic pain patients who are abusing the system. The meds don't make us high. They make us functional. We don't want euphoria. We want to go to the store without collapsing. But that part doesn't fit the narrative. Yep. All right, let's hear from a lifelong martial artist. In the fight world, we called ibuprofen vitamin I. I took it by the handful, not realizing it would slowly destroy my kidneys. Yep. Now I can't take NSAIDs at all. My nephrologist made that clear. My kidneys are failing. That took away one of the few options that helped. Add to that pancreatic cancer. Oh my God, this poor guy. I also suffered a fall while caving. Wow. He is just not having a good time, is he? One large practice had staff who treated people like cattle. You want meds? Shut up and wait. I moved to another facility tied to my oncology center. Better care. But now I drive 60 miles round trip every 6 months for a basic prescription. Belbuca helps. Tramadol helped more. During chemo, they prescribed THC. It didn't erase the pain, but it helped. Then I learned that purchasing a firearm while prescribed THC could result in felony charges. Yes, we've covered that too, over on our Second Amendment playlist, our gun control playlist. Under Biden, it felt like I had to choose pain relief or my Second Amendment rights. So I let the THC go. I'm a firearms instructor. I won't risk it. Yeah, choose between pain or your career. Now I sleep in 90-minute increments. I get cranky when the pain breaks through. I love something like Tramadol for the day and something stronger at night. But doctors today are more afraid of government audits than patient suffering. And that's where people like me get stuck. Waiting, hurting, forgotten. And then Manny's final thoughts here. Pain doesn't just hurt. It erodes. Slowly. Quietly. It takes pieces of you that you didn't know could be taken. Oh man, ain't it the truth? Sometimes the worst part isn't the pain itself, but watching someone you love try to fix it and fail. My wife sets down a plate she made with love. I nod. I try. But I can't eat. And we both know why. That silence between us says everything. So to the families, those who sit beside the bed, refill the pill organizers, wait outside appointments, and carry a kind of grief no one sees, you're part of this fight. What you give matters, even when it feels like it doesn't. And to the officials, administrators, and gatekeepers, your red tape doesn't heal. Your policies don't feel. If the numbers on your forms are the only thing you understand, you've already failed the people you were supposed to protect. Pain patients aren't criminals. Their treatment shouldn't feel like a sentence. Thank you, Manney, for another great one. He's got a place down here where you can share your story, which I did. I clicked on the link and shared my story with him and let him know also about my YouTube channel and the playlist I have going. And he writes, "This isn't about pity. It's about accountability. Every story adds weight to the truth, and truth is what turns whispers into a roar. Veterans, parents, workers, caregivers, real people are being crushed by silence and red tape. That needs to change." You are not invisible, you are not alone, and together we're going to make sure they finally hear us. Thank you so much, David Manney, for doing your part. I'll continue to do mine. So now, all that's left is for you to do your part, which of course is comments for the comment god, shares for the share throne, like, subscribe, and the bell. Do everything you can to get this message out there, to get this video up in the algorithms, to get this article shared around to everyone you can. Anyone you think might even possibly click and listen to a few seconds of it, or load up this page and read a paragraph or two. Every little bit. Because right now we are shouting in a windstorm, and we need more voices to be heard. And of course, you can help me continue this by going to donate.bogosity.tv with either a one-time donation or regular support where you can get benefits like getting the videos early and ad-free, AMAs, and live streams. So thank you so very much for watching. Until next time, stay strong and be free.